Hi, I'm Camela Balcomb, the Executive Director at Shades of Hope, and I want to take a minute to clarify a question that I get routinely. People look on our website, they talk to me, they talk to my marketing reps, and the question always comes back, Cam, what is it you do at Shades of Hope? I see eating disorder, then I see chemical dependency, then I see spending issues. I want to take a minute and clarify. What Shades of Hope treats is the core pain and the core issues. The symptoms, be it an eating disorder, be it an eating disorder in association with other medicators, spending, not being able to budget, maybe drinking too much, maybe not as an addiction, but as an abuse. Those are the medicators. Those are the acting out behaviors that absolutely have to be addressed. Yes, Shades of Hope is known for the eating disorder behavior and the treatment and how it responds to addiction treatment. But where we're all addiction is we're not going to leave it just with eating disorders. Because we recognize that most addictive people also use other things as medicators, be it chemical dependency, be it spending, be it relationship issues. There's a multitude, internet now. But what really comes down to is what is driving the behavior and what are the core issues. You know, eating disorders can be from anorexia, where you're restricting yourself to death, to bulimia, where it's not just about regurgitating, it's about out there running. It could be a multitude of different bulimia things. Down to the other end of compulsive overeating, where you are literally binging and purging yourself, or forget the purging part of it, eating yourself to death. It's about the food, but what is really the issue is about what's driving it. Why am I turning to this to medicating and not having learned how to deal with life on life's terms? And then when that doesn't work, we up the ante. We turn to spending to make ourselves feel better. Maybe to feel numb about the shame we feel about our eating behavior, we turn to alcohol. Or maybe we're going to 15 different psychiatrists or doctors and we're getting prescription meds again to hide the pain and the guilt we feel about the eating behavior. That's where Shades of Hope is all addiction, because we're not just going to leave it with what is this one symptom. We're going to go to the heart, the core, the pain, because until someone stands by your side or your loved one's sides and leads you through that, you're looking at a life of hell. And excuse me for putting it that bluntly, but that's what it is. What we're here to do is help you, if you're the identified patient, or your loved one, learn to heal the pain, learn to identify it, and learn to live life the best they can in a healthy, hopeful, happy way, if at all possible. Thank you for taking a minute to look at Shades. Take the next step, pick up the phone, call us, and let us discuss your individual situation.